Hello everyone, you are listening to Dr. Huma Ibrar, and today we are going to talk about Maitland versus Kaltenborn mobilization techniques. So, in this video, by the end, you will have a clear understanding of all the important concepts of Maitland and Kaltenborn techniques. At the end of this video, I have included MCQs to test your understanding. So, I strongly recommend you to watch the full video carefully, understand the concepts, and then solve the MCQs. Write your answers in the comment section and I will personally correct them. Both the Maitland and Kaltenborn are actually the mobilization techniques. So let's understand what the mobilization techniques are used for. They are used to reduce joint pain, decrease joint stiffness, and then improve range of motion and help the patients move better in daily life. So now let's talk about the first one, that is Maitland concept. Why we use it? The Maitland is usually used to reduce pain and then improve the range of motion, helps relax the joint, improves comfort before the exercise. Best when pain is more than the stiffness. So this is the main point to remember, that the Maitland is used when the pain is more than the stiffness. And oscillatory rhythmic movements are used in Maitland. So how Maitland works: gentle rhythmic oscillatory movements are used and are always within the patient comfort. Force adjusted according to the patient's feedback. So let's talk about the grades of Maitland. Grade number 1 is small amplitude movement at the beginning of range, severe pain and spasm. So the grade 1 is used in severe pain and spasm. Grade 2, large amplitude movements within mid-range of motion. So the grade 1 was at the beginning of range of motion, and in grade 2 we use at the mid-range, and it's also for pain relief. So let's talk about the grade 3, that are large movements up to the end range of motion. Remember, the first one is beginning range of motion, the second is in the mid range of motion, and the third one is at the end range. So the grade 3 is used to remove the stiffness. Now let's talk about the grade 4, small movements at the end range of motion. So these are the movements that are at the end range and used to improve mobility. So let's talk about the grade 5, small amplitude movements, thrust, that are manipulations actually. So it's only done by the experts. Key line to remember in Maitland is that the Maitland is used to control pain using oscillatory movements, and it's pain-oriented approach and fully depends on patient's comfort or patient's feedback. So now let's talk about the second one, Kaltenborn concepts. Why we use Kaltenborn technique? The Kaltenborn mainly used to increase joint movement based on joint biomechanics. And so the first one, Maitland, was basically used to reduce pain, and the Kaltenborn is used to increase joint movement. So this is the main function of Kaltenborn, to increase the joint movement, and the main function of Maitland was to decrease the pain or remove the pain. So based on the joint biomechanics, stretches tight joint capsule by traction and improves functional range of motion. Kaltenborn is used when stiffness is more than the pain. So this is also the point to remember, that the Maitland is best used when there is pain more than the stiffness, and Kaltenborn is used when the stiffness is more than the pain. So this works on convex concave rule. So now how Kaltenborn works: uses sustained traction or glide, joint held in stretched position based on joint biomechanics, and it's combination of traction and then mobilization. Sustained movement rather than oscillatory like in Kaltenborn. So this is the point to remember: traction and mobilization, and sustained movement rather than the oscillatory movements like in Kaltenborn. So let's talk about the Kaltenborn grades. Grade number 1 is small traction, a distraction of minor intensity that causes stress within the joint capsule and is used for pain relief loosening. This is grade 1 is usually called the loosening grade. Grade 2 takes up the slack of force that stretches the periarticular tissue and is used to control pain plus stiffness. And grade 2 is often related to tightness. And grade 3. Now let's talk about the grade 3. Strong stretch causes enough distraction or gliding so that the joint capsule can sufficiently stretch. So it is used to increase range of motion. And this grade is associated with stretch, grade 2 is associated with tightening, and grade 1 is associated with loosening. So these are the things to remember. The now key line to remember in Kaltenborn is mobility improvement using sustained stretch. So Kaltenborn works on mobility improvement using sustained stretch. Now let's understand the difference between these two. Maitland is pain-based technique while Kaltenborn is range of motion-based technique. Maitland is used when there is more pain and Kaltenborn is used when there is more stiffness. Maitland uses oscillatory movements while Kaltenborn uses sustained holds. Maitland works on patient feedback and totally depend on patient's comfort, while Kaltenborn uses joint biomechanics. And Maitland, they are 1 to 5 grade and Kaltenborn 1 to 3 grade. Simple memory trick, pain problem, we'll use Maitland. Movement problem, we'll use Kaltenborn. So how to explain a patient about if you are doing a Maitland or Kaltenborn techniques on them? For Maitland, you will have to tell them, I am gently moving your joint to reduce pain. For Kaltenborn, I am gently opening your joint to improve movement. Simple. So the summary is Maitland is used to reduce pain, Kaltenborn is used to increase movement. Both help patients to return to daily activities. Now let's move towards the MCQs. Question number 1. Maitland mobilization technique is primarily based on option A, joint play, pain response, muscle strength, or and feel. I want your answers in comment section. Now question number 2. Which type of movement is used in Maitland technique? Sustained stretch, passive rotation, oscillatory movement, active movement. Question number 3. Kaltenborn concepts mainly focus on option A, pain relief, option B, muscle relaxation, option C, joint biomechanics, and option D is neural mobility. Question number 4. Kaltenborn mobilization techniques or grades are 1 to 4, 1 to 5, 2 to 4, or 1 to 3. Question number 5. Sustained mobilization is a feature of Maitland, Mulligan, Kaltenborn, or McKenzie. Question number 6. Maitland grade 1 and 2 are mainly used to increase strength, improve joint play, reduce pain, or stretch capsule. Question number 7. Which concepts emphasizes convex concave rule? A. Maitland, B. Kaltenborn, C. Sirieix, and D. Bobat. Question number 8. Oscillatory mobilizations are best described as A. Long held stretches, B. Rhythmic passive movements, C. Active passive movements, D. Isometric contractions. If you have any questions, drop them in the comments and comment your suggested next topic in the comment box. And I will correct all these answers in the comment section. Like, comment, and share. And if you still haven't subscribed my channel, kindly subscribe my channel for more important lectures and updates.